So coming to autophagy, now this is a very important mechanism. So what is autophagy? Autophagy means it is a process when a cell is eating up its own content. So you must understand why does this happen. This is autophagy is basically a survival mechanism. When the body or when the cell itself is not able to survive, it eats up its own content, and that is how it kind of protects the cell. So it is a survival mechanism under various stress conditions, maintaining the integrity of the cell. Therefore, it is prominent in the atrophic cells exposed to severe nutrient deprivation. So whenever in the MCQs you will get this word known as severe nutrient deprivation, the answer is going to be autophagy and not apoptosis. Cell death doesn't happen by apoptosis over here. The important answer will be autophagy in case of severe nutrient deprivation. But again, when this autophagy is not able to cope up with the stress, then obviously the cell will undergo apoptosis. So apoptosis many forms is the highest form of cell death when the cell is not able to tolerate, is not able to adjust, then only the apoptosis mechanism comes into play. Okay, so what is the process now? It involves the delivery of the cytoplasmic materials to the lysosome for degradation. ठीक है, तो initially क्या होता है कि initially this formation of something called as the phagophore, as you can see. ठीक है, so and then ultimately it will fuse with the lysosome, and that will ultimately cause degradation of the autophagosome, and the cell ultimately gets destroyed. So basically what happens is whenever there is a nutrient deprivation or depletion of the growth factors, that will activate an initiation complex, and now this autophagy related genes or the ATGs will now get activated. Okay, now there's formation of something called as the initiation membrane. As you can see over here, this formation of something called the initiation membrane, which will elongate, okay, which will keep elongating, and it will capture its cytosolic materials to ultimately forming this entire circular autophagosome. Okay, and please understand another important point, that is this elongation and this initiation membrane closure will require the coordinated action of two ubiquitin like conjugation systems, that is the linkage of the lipid phosphatidyl ethanol amine or PE to the microtubule associated protein light chain 3 or LC3. So there has to be an interaction between these two, which are the two molecules, the phosphatidyl ethanolamine and the protein light chain 3. So there has to be an interaction between these two, forming the PE lipidate LC3. Okay, once there is some kind of bonding or kind of covalent linkage with this, that will ultimately cause the formation of the autophagosome. Okay, so PE lipidate LC3, very important question, is increased during autophagy, and it is therefore a useful marker for identifying the cells of autophagy. So apoptosis में which was the marker, annexin 5, यहाँ पर the PE lipidate LC3 is the marker. Very important question. ठीक है, and now this autophagosome will fuse with the lysosome to form the autophagolysosome, and it is degraded by the lysosomal enzyme. So I've already explained this. You can see this diagram. Ultimately there's formation of this autophagosome binding with the lysosome, and there's going to be degradation. So what are the conditions? You can see this cancer, in cases of cancer, in cases of neurodegenerative disorders like Alzheimer's disease is characterized by impaired autophagosome maturation. Again, a very important point. Infectious diseases like Shigella, HSV1, inflammatory bowel diseases like Crohn's disease and ulcerative colitis, where the gene involved is ATG1 6L1. Again, a very important point. So again, in these two diseases, this is the autophagy gene which is involved. Okay. So coming to the mechanisms, now these are the general mechanisms of cell injury. As I've already mentioned, that cell injury can occur at 3 levels. Number 1, at the mitochondrial level, at the membrane, the cell membrane level, and the DNA level. Okay? So all these 3 are different, and what is the most important point is the mitochondrial damage, because there are severe consequences for this. What are the consequences because of mitochondrial damage? There's going to be ATP depletion, and once there is ATP depletion, there are a lot of other implications of that. What are they? Number 1 is the cell swelling. what happens is, you know that there's a sodium potassium pump. I have already told this before. This sodium potassium pump will kind of throw the sodium out and it will bring the potassium in, but because the pump is not functioning because of ATP depletion, it's an ATP dependent pump, so because this pump is not functioning, it will draw the sodium inside, and along with that the water will also come inside, so there's going to be cell swelling. Okay, because of ATP depletion, there's not going to be aerobic mechanism, so there's going to be anaerobic mechanism and accumulation of lactic acid. Okay, reduced protein synthesis, lysosomal and mitochondrial membrane damage will ultimately lead to necrosis, incomplete oxidative phosphorylation, activation of the pro-apoptotic channel, which is the back, leading to the increase in the cytochrome C caspases. So all these things points I have already mentioned. It's just a brush up of those important points. See, so yes, so coming to mitochondrial damage, number one point is the ATP depletion. As you can see here, whenever there is mitochondrial damage, there is decrease in the ATP and increase in the ROS, which ultimately causes cell injury and necrosis. Okay, whenever there is any kind of injurious agents, what will happen is the cellular membrane is getting attacked. There is damage to the lysosomal membranes, causing leakage of this enzyme, and a damage to plasma membrane also, which will cause the leakage of the cellular contents, leading to necrosis. Okay, and also this DNA will be damaged, which will lead to ultimately apoptosis of the cell. The major causes of ATP depletion are reduced oxygen supply and nutrients. Okay, the mitochondrial damage will result in this opening of the high conductance channel called the mitochondrial permeability transition pore, which will cause further loss of the mitochondrial membrane potential, leading to further loss of ATP, and that will ultimately culminate in necrosis. Okay. So you can see here that this ATP pump, this pump is no more functioning, and sodium will accumulate and water will accumulate, so cell swelling will happen. The metabolism is altered, there is decrease in the cellular ATP, and glycolysis will now take place, anaerobic conditions, and therefore this accumulation of lactic acid, which will reduce the intercellular pH, resulting in decreased activity of many cytosolic enzymes. I've already told about these things to you. Okay, and there's also because of the depletion of ATP, there's also detachment of the ribosomes from the ER, and a consequent reduction in the protein synthesis and protein misfolding, and all of this, and necrosis. So ROS will be there's going to be formation of this ROS, and also apoptosis will be increased because there's increase in this pro-apoptotic proteins. Now, what is this membrane damage? As you can see that whenever there is decrease in oxygen, you can see there is decreased phospholipid synthesis, so phospholipid loss is going to be there, and if this cytosolic calcium is increasing, then it will cause phospholipase activation, which will break down the cell membrane, protease activation, which will break down the cytoskeletal damage, and all of these points together will ultimately cause the membrane damage. So this is how membrane damage is occurring. Okay, so all these points are mentioned in the details here. So the damage to DNA is another important factor. Now you must know that whenever the DNA is damaged, initially there is no apoptosis. First, the body will try to repair it. It will activate the p53 gene, and the p53 gene will arrest the cell cycle in the G1 phase of the cell cycle. So it will, whenever there is any kind of damage to the DNA in a cell, first the p53 will get activated, which will arrest the cell in the G1 phase, and it will try to repair the mechanism. It will try to repair the DNA. Okay, but if this repair mechanism fails, then only there's going to be apoptosis. So if it is a normal cell, and if there is some kind of injury, then the p53 will be first activated. It will arrest the cell cycle in the G1 phase, and then it will try to repair its injury. But if that doesn't happen, then there's going to be apoptosis. This is how the sequence takes place. I hope that makes sense to you. Okay, now oxidative, I haven't gone through this because I don't feel there is much concepts here. Okay, these are not much things to understand, although you may get short notes from here, but I don't think that you need to kind of, you can see all these things I've already mentioned, so just repetition. These are easy concepts, nothing much. So I've already explained this part as well, that whenever there's increase in the cytosolic calcium, then what happens? Calcium is important, but then again, if it is increased, then what happens? I've already mentioned all of these intracellular enzymes are getting activated if there is intracellular increase in the calcium, as you can see, phospholipase is getting activated, protease getting activated, endonuclease activation, and ATPase activation, all of which will break the plasma membrane and nuclear damage will happen. So ultimately there is going to be destruction of the cell. Okay, so now this also I have explained you in the previous chapter, that what is the unfolded protein response. So basically initially what happens is there's something called as chaperone, which helps in folding of the proteins or formation of mature proteins. But when there is excessive amount of misfolded or unfolded proteins, then the body will try to destroy those proteins by the mechanism, by the action of proteases. And these proteases will only destroy those proteins which are ubiquinated. ठीक है, but if these proteases, if these proteosomes are not able to function properly, then there's something called as the unfolded protein response or the ER stress response which comes into play. What will that do? That will ultimately cause an increase in the chaperones, a decrease in the protein synthesis. But again, if all of these mechanisms are not able to take care of the situation, and the situation, the cell is unable to cope with that, then ultimately there's going to be activation of the mechanism of apoptosis. So this is apoptosis is the highest form which is coming into play when nothing can actually take care of the cell. So this is a very important, you can see here the whatever I've explained, that is only given here. Okay. First, there's some kind of adaptation happening by decreasing protein synthesis, by increasing the chaperones, which is the unfolded protein response, as I mentioned. But again, if this doesn't, cannot take care enough, then if there's failure of this adaptation process known as the UPR, then there's going to be apoptosis. I have just explained this before. So this is a very, very important chart. Misfolding of proteins, which are the diseases that actually have this misfolding of proteins: cystic fibrosis, LDL, familial hypercholesterolemia, Tay-Sachs disease, hexosaminidase beta unit. This is a GM2 is again an important question. Alpha 1 antitrypsin, then Creutzfeldt-Jacobs disease, and all these things are important here. Okay. Now, this I have already explained. This is just a repetition of whatever I've explained before. You can see because of decrease in ATP, there's decrease in the potassium pump, and all of this will take place. So there's going to be the cell will swell up, and there's going to be increase in the anaerobic glycolysis. So decrease in glycogen, increase in lactic acid, decrease in the pH, clumping of the nuclear chromatin, detachment of ribosomes, and decrease in the protein synthesis. So all these things are actually the result of decrease in the ATP, which is a very important mechanism. So the damage to mitochondria is actually causing this decrease in the ATP, and ultimately these things are vice versa. Okay, they're interconnected. Okay, so I hope that these are all, again the same thing. Now there's a very important concept here which is known as the ischemia reperfusion injury. Now this is important to understand what is the meaning of ischemia reperfusion injury. See, whenever there is ischemia, there is some kind of injury that we know, right? So whenever there is ischemia, there is injury. But what is this reperfusion? During ischemia, if there is some kind of reperfusion will kind of save the cells from getting destroyed, isn't it? Whenever there is reperfusion or restoration of the blood flow, the ischemic area will retrieve. The ischemia area will no more suffer injury. It will kind of start to heal. It will have its survival now. But during this process of reperfusion, there is damage to some kind of cells. Some cells are damaged and destroyed, and there is cell death happening because of this reperfusion in some of the cells, and that is what is called reperfusion injury. So this is a price that these ischemic cells has to pay. Okay. See, these reperfused tissues, they may sustain loss of viable cells, okay, in addition to those that are irreversibly damaged by the ischemia. Okay, this is called as the ischemia reperfusion injury. I hope that you are able to understand this. Okay, that happens with the myocardial and the cerebral infarctions. Now, why does this happen? Okay, why does this happen? Number one, because of the oxidative stress. So when there's restoration of the blood flow, there may be an increase in the reactive oxygen and nitrogen species leading to oxidative stress, which may destroy the cells. Intracellular calcium overload, there may be increase in the calcium inside the cells. which will cause damage to the cell membrane and the ROS mediated injury. Calcium overload may also cause opening of the mitochondrial permeability transition pore with resultant ATP depletion. There can be inflammation also, obviously some kind of danger signals are there, so there will also be inflammation going on in that area, and cytokines are also released, so that will again cause recruitment of more neutrophils into the reperfused tissue. So this inflammation will cause the additional damage. So that these are the mechanisms how this reperfusion may actually cause death of certain kinds of cells as well in that area. It is a kind of an irony, right? It is a kind of an opposite action. Reperfusion should not cause injury, but then there is some kind of injury, and that is what is called as the ischemia reperfusion injury. So coming to the adaptations, the cellular adaptations are not very difficult to understand but very important. So I'm just going to go very fast over here. Hypertrophy increase in the size of the cells. There are two kinds. Number one is the pathologic, number one, and the physiologic. Okay, we know all of this. Now hypertrophy, why does that happen? What's the mechanism of hypertrophy? It is because of an increase in the cellular protein production. Okay, the protein production is increased because the cell size is increasing, so the protein present in the cell has to be synthesized in more amounts now. Okay, so number one, what happens is because of these sensors, see this see this image. This is what is happening in the case of myocardial hypertrophy. In case of myocardial hypertrophy, whenever there is increase in the mechanical stretch or agonist or growth factors, this activation of the signal transduction pathway, which will release these transcription factors, that will cause an increase in the synthesis of contractile proteins, increase in the growth factors, then induction of the embryonal or the genes, increase in protein degradation, switch in the gene expression, increase in the gene expression, recruitment of the steroid cells, and all these mechanisms will cause an increase in the mechanical performance and decrease the workload. That is how there is myocardial hypertrophy. So what basically happens is there is some activation of the signal transduction pathways over here. Okay, now in cases of physiologic hypertrophy, there is going to be activation of the PI3K AKT pathway. Important question. And in case of pathologic hypertrophy, there is going to be activation of the GCP or the G protein coupled receptor initiated pathways. Very, very important. Both the pathways of signal transduction are different. Okay, that will ultimately cause the release of the growth factors and the transcription factors, which will cause an increase in the translation, and therefore there's an increase in the protein synthesis, and that's how there is hypertrophy. Okay, you can see here the plump cells of the uterine smooth muscles, as you can see. Okay, so these important names also you can just go through it, the names of the transcription factors. Hyperplasia is increase in number of the cells. Again, there's going to be physiologic hyperplasia and pathologic hyperplasia. Examples you can read by your own. Nothing much to understand here. Important point is what's the mechanism of hyperplasia. There is a growth factor driven proliferation of mature cells, and in some cases by increased output of new cells from tissue stem cells. So here the tissue stem cells are getting activated, or rather I will say that tissue stem cells is playing an important role because they're now generating more and more number of cells. Okay, what is atrophy? Size and number of the cell both are decreasing here. Physiologic atrophy is seen in notochord and thyroglossal cyst atrophy and in the uterus after parturition. And you can see this pathologic atrophy in cases of decreased workload, disuse atrophy, loss of innervation, denervation atrophy, diminished blood supply, inadequate nutrition, loss of endocrine stimulation, and pressure or tissue compression. Early in the process, the cell have diminished function, but the cell death is minimal. But then if there is a continuous stimulus, then there's a point where it becomes irreversible. The cell becomes irreversibly injured, and then again there's going to be apoptosis. Okay, now what is the mechanism of atrophy? There is decrease in the protein synthesis and there's an increase in the protein degradation. So here just the opposite happens. Obviously the protein synthesis will decrease, and whatever protein is there, it will get degraded. So again this degradation will happen by the ubiquitin proteasome pathway. Important. Okay, Again, there can be some kind of autophagy in case. This is again an important MCQ actually, as you can see that autophagy happens, okay, and some of these cell debris within the autophagic vacuoles may resist digestion and persist in the cytoplasm as membrane bound residual bodies. These residual bodies, one example is the lipofuscin granules, which is present and it is known as the brown atrophy of the heart, okay. So this is again an important MCQ which comes, okay. Next is the metaplasia, differentiation of one cell type to the other cell type. So the most common is columnar to squamous, but again there can also be squamous to columnar in case of Barrett's esophagus. Connective tissue metaplasia happens in case of myositis ossificans. The mechanism is very important here. What happens is the stem cell itself gets reprogrammed. ठीक है, तो क्योंकि अभी क्या होता है कि स्टेम सेल itself gets reprogrammed, so whatever new cells are being generated, they are generated of the new type, new differentiated cell type. So because metaplasia means from one cell type to another, so when there's reprogramming of these stem cells, now itself it is producing the new kind of cells, or by colonization of differentiated cell from the adjacent areas also sometimes this happens. This is the mechanism of metaplasia. You can see over here, this is the columnar area, this is the squamous area. It is seen in the bronchus and also you can see it in the cervix. Okay, now intracellular accumulation, this is a very easy topic. As you can see, there are some kind of accumulations which keep happening because either because of inadequate removal, accumulation of an endogenous substance as a result of the defects in its folding, packaging and transport or secretion, like in case of alpha antitrypsin. So these mechanisms and its examples are important. You must link both of this and this can come as an MCQ. Okay. Failure to degrade a metabolite, like in cases of lysosomal storage disorder, and abnormal exogenous substances like the silica particles. So what happens is lipids, when it gets accumulated, there's kind of a steatosis or fatty change in which there's accumulation of triglycerides in the liver and also in other organs known as the fatty liver. Cholesterol and cholesterol esters can also get accumulated. You can see that in the atherosclerosis, xanthomas, cholesterolosis, Niemann-Pick disease. All these are important examples. These images are important. You can see this cholesterol laden macrophages or the foam cells over here in the gallbladder cholesterolosis. So these images are again important. Okay, जितने भी images हमने I have explained, all of them are important. So proteins, obviously they are accumulating as eosinophilic droplets, vacuoles or aggregates in the cytoplasm. Reabsorption droplets in proximal renal tubules, and these proteins may also be normally secreted and in excessive amounts may accumulate in the endoplasmic reticulum, happening for example the Russell bodies. So this is also an important question. The ERS becomes hugely distended, producing large homogeneous eosinophilic inclusions called the Russell bodies. Now, defective intracellular transport and secretion of critical proteins. This mechanism is important in cases of alpha-1 antitrypsin deficiency and cystic fibrosis. Again, a very important question. Accumulation of cytoskeletal proteins like the intermediate filaments. Alcoholic hyaline is an eosinophilic cytoplasmic inclusion in the liver cells. The neurofibrillary tangle found in the Alzheimer's disease contain neurofilaments. Aggregation of abnormal proteins are seen in Alzheimer's disease, Huntington disease, amyloidosis, and these proteinopathies as well. Hyaline change is nothing significant. It just gives a homogeneous glassy pink appearance. Okay, intercellular hyaline accumulations may occur, like for example Russell bodies, then alcoholic hyaline, all of this. So these are not much important. You just need to go through it because there's no concept here. You just need to go through it. Exogenous pigments like anthracosis, okay, where there's deposition of the black carbon or coal dust. Endogenous pigments like lipofuscin is a wear and tear pigment. This is a very important MCQ. It's a telltale sign of free radical injury and lipid peroxidation. Again, a very important point. Okay, so you can see this lipofuscin granules. Please make a note of these images. And this image is, you can see this is the accumulation. Okay, so this is the image of electron microscopy. So nowadays also people are, the Neet PG wale, I think there are some questions regarding electron microscopy also. So these images can be asked to you, so you just brush up these images. So melanin is the only endogenous brown black pigment, and there's another pigment called homogenesic acid which gets accumulated in something called as the alkaptonuria, where the pigment is deposited in the skin, connective tissue, cartilage, and is known as ochronosis. all these things are important points. You will read about this in detail in biochemistry. So then hemosiderin is a golden yellow colored to brown colored pigment, which is granular or or crystalline pigment, major storage form of iron. Now coming to pathological calcification, you know that there are two kinds of calcification. Number one is the dystrophic and number two is the metastatic. So what happens is metastatic calcification occurs in the normal tissues, okay? But what happens is here there is some kind of disturbance in the calcium metabolism. But in dystrophic calcification, there is no derangement in the calcium metabolism. It is just that the serum levels of calcium is normal and there is no derangement in the calcium metabolism. That is when the deposition is known as dystrophic, and in cases of metastatic there is some disturbance in the calcium metabolism. So all these examples are important. Atheromas, damaged heart valves, in all these areas you find this dystrophic calcification, means these are happening at this calcification deposits are happening at abnormal sites where it should not deposit. So this calcium salts, they are basophilic, amorphous, granular, sometimes clumped appearance, heterotopic bone, and this progressive accusation, they create lamellar bodies known as samoma bodies, and all these things are important. And what are the examples of metastatic calcification? Increased secretion of parathyroid hormones with subsequent bone resorption, as in hyperparathyroidism due to parathyroid tumors, resorption of bone tissue secondary to the tumors of bone marrow, skeletal metastasis, immobilization, vitamin D disorders, idiopathic hypercalcemia known as Williams disease, and all this, and renal failure, and all these things. Okay. Now coming to cellular aging, here you must know the importance of something called as the telomere. I've already mentioned this before, that telomeres are short sequences which are present at the ends of the chromosomes, which protect the ends from degradation. And the enzyme that is functioning here is the telomerase. But once there is no functioning of this enzyme, so this protection will not be there, and therefore these telomeres will become shorter. The ends of chromosomes will cannot be protected, and they are seen as broken DNA, which will ultimately cause the cell cycle arrest. Okay. So this is it. I hope that I have been able to make some sense to you from these important points. I went a little fast because I've already mentioned, I'm only mentioning those high yielding areas only, or most important parts only. The others I am just brushing through. Okay. So if you have any more query, you can mention down in the comment section below, and you can also give me feedback as to what other inputs can I have in my videos and etc. So I hope you are enjoying this series of videos. I will be back with the next chapter, which is the inflammation, very soon. So take care, keep studying, and thank you for watching.